My name is Robert Scott Fishel, Robert S. Fishel, MD. I'm the Director of Electrophysiology. So atrial fibrillation is a very common arrhythmia. It is an arrhythmia which involves the atria. Now ordinarily with the atria, there's 4 chambers, there's 2 atria in the heart, and there's 2 ventricles. With atrial fibrillation, the upper chamber basically goes crazy. The upper chamber rate in atrial fibrillation can be between 300 and 500 beats per minute. Instead of the atria contracting normally or even fluttering, the atria just quivers. Approximately 40% of the population over the age of 60 at some point in their lives will have problems with atrial fibrillation. When blood doesn't move, blood can clot. And so one of the major issues with atrial fibrillation is that if you're in Afib, you can be at risk for stroke. And with catheter ablation, you put a catheter into the patient's heart by putting it into a vein in their leg, and you go up into the heart and you find the areas that cause Afib, and you eliminate the abnormal areas with a catheter. With an ablation procedure, the patient's put on the electrophysiology table here. They're put to sleep. We then put some small tubes in the vein in the groin, so in the femoral vein, and we go up into the heart, and in the heart we put something like this. This is an ablation catheter. And amazing what has happened from when I started as an electrophysiologist, where the only way to treat this was to open somebody's chest and do a major open heart surgery for Afib, to now where we can do something in about an hour with somebody under anesthesia, and they go home the same day, and this will fix many patients with Afib and ablation procedure.